One of the skills at the foundation of our EMS toolbox has to be airway management. We spend the most time trying to figure out the right way to have strong and solid airway skills, and we're even changing our practices. Presently, we're in the days of pit crew CPR, which overviews more of a focus on doing all we can to get that return of spontaneous circulation. And proper use of the BVM is critical in these days of high-performance CPR. The world of EMS now needs to look at the tools that it can use to close this loop. What if there was a BVM that provided all the tools necessary for effective airway management, even in the hands of the inexperienced provider? I'm Chris Cebollero, and this is the Innovation Zone. When I was taught airway management back in the old days before electricity, standard tidal volume was 10 to 12 cc's per kilogram. And with the current size of the BVM, about 1600 cc's, and we were taught to get as much volume out of that bag as possible with each squeeze. Even though we learned tons on barotrauma, what we didn't learn a lot about was volutrauma. This is where overstretching of the tissue in addition to the pressure from too much volume. Today, there is current research that is now suggesting that we should only be delivering between 5 to 6 cc's per kilogram. The small adult CPR-2 bag from Mercury Medical can help you maintain these optimal levels and provide additional support in your airway management. The volume of the bag is about 1000 cc's, which allows a stroke volume of about 750 cc's and stays within that 5 to 6 cc per kilogram range. The CPR-2 bag is a single-use disposable manual resuscitator that provides the necessary support for using a face mask or an endotracheal tube. It has a built-in manometer, which allows you to monitor airway pressure while maintaining a time sequence for both adult or pediatric patients in respiratory or cardiac arrest. What's great about using a bag with a manometer is that it allows you to keep track of the rate, volume, and pressure with an accuracy of plus or minus 3 centimeters of water pressure. Without a manometer, you're taking a risk when trying to get chest rise, but the feedback from the manometer allows you to get the correct pressure in without adding volume because you have more bag to use. The bag also has a PEEP valve which can be set to be used between 0 and 20 centimeters of water pressure, which allows you to choose the exact pressure to meet your patient's needs. One of the things I love about the CPR-2 bag is the lightsaver feature. It takes the guesswork out of when to deliver ventilations when using advanced airway for both adult and pediatric patients. Once you pull the red tab, the light will activate and blink once every 6 seconds. This allows the rescuer to deliver 10 breaths per minute. The CPR-2 bag can be used for both adult and pediatric patients, so you don't have to worry about carrying 2 different bags. The bag is made from a new thermoplastic material that's latex-free. It makes it easy to control your technique and to deliver the appropriate volume to the patient. This is good news, especially for someone like me. I've always had small hands and had to constantly adjust my technique to allow for the best volume delivery. But with the CPR-2, it feels like it was made with me in mind. As providers, we're always wondering if our airway management is allowing our patients to get the very best ventilations possible. Mercury Medical hit a home run here with the small adult CPR-2 bag. I gotta tell you, I really love this product. It's easy to use for both adult and pediatric patients. In advanced airway management, the lightsaver helps you deliver the appropriate number of breaths per minute. You could also use PEEP, and best of all, the manometer allows you to always deliver the appropriate volume. Mercury Medical has taken the guesswork out of our airway management with the small adult CPR-2 bag. I'm Chris Cebollero, and thanks for joining us on the Innovation Zone.